End of week 36. Not quite reached 37 weeks and my waters have just broke. So we're now in Kingston Malvern Suite, which is a like birthing centre where we wanted to give birth, but we're here temporarily. We've gone into the assessment and baby's fine. Now, because I'm a few days preterm, it means that I have to stay in the hospital now because they won't want me to go into labour at home in case of infection or something like that. So it means potentially a good couple of nights in the hospital.
A long stay.
We're going through the hospital bag that we partially packed to see what's missing and what we need. And we're just watching good old Emily Norris, watching what to pack in your hospital bag. So thank you, Emily. Nick's gonna rush off on a shopping trip now. Bizarre sending a man off to go and buy you underwear and bits and bobs. It's about 6:30 in the evening. I've been in for 7 hours. Nothing's really happening. I'm having very light cramps and strange feelings in my hips. If labour doesn't establish soon, then I guess I'll be spending the night here on my own. That's not what I wanted. The most important thing is for me to try to still have this kind of very natural hypnobirthing, positive birth experience. So I'm trying to imagine that I'm a caterpillar and I'm turning into a butterfly, and that everything I experience is going to be very natural, very normal, that my body knows exactly what it's doing. No panicking, no stress, no anxiety, just zen, chill.
Falling somewhere between hero, role model and protector, you are now stepping into those shoes. You owe it to yourself and your troopers to be the best dad you can be right now. Let's commence training.
Second day in the hospital. So last night Nick went home to sleep in the nice big bed, and I was moved onto what's called the antenatal ward. It was quite a difficult night's sleep, I have to say, with regular observations. So they're checking things like temperature, blood pressure, and doing monitoring of baby's heartbeat as well. Mild cramping, bit of backache, but no signs of anything starting. So we do some bouncing around on the ball. That's me, not him. And then we're going to do some.
I will too.
And then we're going to do some walking around the wards to see if we can get things going. Maybe have a takeaway curry. I've been drinking raspberry leaf tea as well. But otherwise, if nothing has happened by tomorrow, they will induce us. So let's see if we can get things kicked off naturally. Get on that ball.
Hello and welcome to Profiles in Twosies, a father-to-be's diary on how to go to the toilet in labour ward. First things first, it's complicated. There is not often an opportunity to be able to go and release the beast in this sort of environment without being disturbed. My first attempt was met by a toilet where somebody else had already been for a toosie. I knew this because some of it was on the seat.
Oh, babe.
I've just recently asked where the best place to go for a guest toilet is and was reliably informed by the midwife that I could use the one in the room. I then asked her if she'd be here for the rest of the day, and she said yes. Constant attention while you're on the hormone drip. Option 1 is no longer an option.
Oh, baby. So today is day 3 in the hospital. They've moved me onto labour ward. Hello.
Oh.
They've moved me onto labour ward and I'm now on a drip, you can see. They put the cannula in and I'm being dripped with the oxytocin replacement.
How does it feel? Does it make you feel happy?
I'm not feeling happy. I'm definitely already starting with contractions. I was very nervous about this option, but this is the only option. So it is what it is. We've got a nice big private room with a beautiful view. And so we're just trying to stay positive.
So pretty.
Oh wait, it's ouchy.
How does it feel out of 10?
Just a half.
A half.
We have to say this. It's just a half. But baby should be here today. That's exciting.
Don't forget to think happy thoughts.
I'm thinking happy thoughts. I'm
Yeah,
thinking I'm gonna
comfortable.
become a butterfly.
Butterfly is happening in your room.
Nick is my lovely birthing partner. Is trying to keep me relaxed by like brushing my hair. This is the second hairdo. We don't have a very straight parting, but it's a very good attempt at pigtail plaits. Oh, that one's right behind my ear, but this one's in front. This one kind of is very long-ended.
Just because this one's sexy and this one's...
And this one's a short end. But it's a very good job. It's a very good job. It's a good practice for when baby number 2, that turns out to be a girl, comes along. If that happens. I'll have to see how today goes. That's all going very well. I'm going to be examined in about 5 minutes to find out if I've been dilating yet or not. But we're doing cool. We've been listening to music. Nick's been playing with my hair even more. And doing puzzles. Are you a fan of arrow words now, Nick?
I love them.
He didn't know what they were before. He does now. And he knows that I'm very good at them. And when we can't find the answer, we just look in the back. Baby seems to be doing okay. So far so good. Fingers crossed for a bit of dilation.
And that is how Anna Tyree absolutely nails a contraction.
Give it time. Hey guys. So it's 9:30, just gone 9:30 at night. I've had 2 internals. The first internal showed me at, 1 centimetre, which is not very much. And now the midwives have changed over and now at 3, maybe 2.5, 3 centimetres.
Yeah.
They felt membrane on the baby's head, so they've used a hook. Not the most comfortable experience, but yeah, we're getting there.
What did they tell you after that one?
So basically I've been given 2 hours to show progression. Otherwise they're going to have to make the decision to take me down to have a C-section. And I'm going to have that last exam anytime, whenever the midwife comes in. So
What does she want to see?
She wants to see 5 centimetres.
Yeah.
If she sees 5 centimetres, then we carry on, have the baby. If not 5 centimetres, if it's anything less, then I go for a C-section.
And why do we go for a C-section? And so, say toot toot when you need it.
Yeah, no.
Okay. They're a lot more intense.
we're having fun.
So because we've been on the hormone drip for 12 hours...
That's why they would want to C-section you, because they say that your
You've been on it for too long, yeah.
Your uterus gets tired.
Yeah, so we're hoping to see substantial progress. Otherwise, we'll go and get a baby out.
Oh, God. Oh. Why are they still so strong, baby? Oh. There's no point now, just chill out. You had your chance, you didn't do it. Oh, that is horrid. Horrid. Hi baby, you look so worried. Okay,
Are you feeling okay?
Yeah.
Good luck, baby. You're gonna be fine.
Okay.
How are you feeling?
Crappy.
Yeah. Are you starting to see the point? You're fine.
So when we bring the curtain down, you won't see yourself. You'll just see the curtain. And sometimes they're a bit sleepy when they're first born by Caesarean, so don't worry if he's not immediately crying or wiggling. So they're pushing because you can't, so that's what this bit is.
You're doing a great job. I feel a bit of pressure. You'll see him soon.
And when he's born, he often goes straight over to the resuscitation chair over there to get dried and woken up a little bit.
Clear his lungs. There was.
Yeah, exactly.
There we go. You didn't want to come.
That's the thing, I think.
Yeah.
Decided yes.
So at least we're covered, and you're a good radiator.
Oh, did we find out his weight?
£6.15.
£6.15.
So a shade off 7.
Okay. Oh.